More children and teens are being admitted to hospitals with COVID-19 as a result of the Omicron variant, with 251 children under 12 admitted in just the past week. Booster shots are now being recommended for 12 to 17-year-olds with underlying conditions or at high risk of being exposed to the virus. Canada's top doctor says the new sublineage of Omicron, BA2, is being monitored but isn't much of a concern right now.
At the moment, the international data suggests that it could potentially have an increased advantage on spread, but there doesn't seem to be any specific increase in hospitalizations or the severe outcomes compared to BA1.
Dr. Theresa Tam says Canada has been finding it as far back as November and says it's not known how it will factor into this country's fight against COVID-19.
Getting to perhaps the peak is one thing, but coming down the other side of the wave includes a lot of people who could get infected, and some of them could potentially be infected with BA.2.
Meanwhile, the National Advisory Committee on Immunization is now recommending teenagers with underlying conditions or at high risk of COVID-19 exposure get a booster shot. But for healthy teens, it's not necessary.
A booster dose for the 12 to 17-year-old without the medical or social risk factors is not recommended due to the generally low risk of severe COVID-19 outcomes in adolescents who've received a complete primary series.
Tam says hospitalizations and deaths from Omicron are still high. The number of daily deaths averaged 168 in the last week. She says that's the highest it's been since the early days of the pandemic in April and May of 2020. This comes as the truck convoy protesting the federal vaccine mandate makes its way to Ottawa.
The convoy of which we should be speaking is a convoy of everyone being on board, knowing that the enemy is not vaccination, the enemy is COVID-19.
An average of 10,800 people were in hospital with COVID-19 over the last 7 days, up from 10,041 the previous week.